Hi, everyone, and welcome to another episode of Next Up Narcissism. Today's episode is extremely interesting and very necessary. Today, I am honored to have with us Dr. Lina Haji. She is a licensed clinical and forensic psychologist and licensed mental health counselor specializing in psychodiagnostic assessment, forensic assessment, dual diagnosis, serious and persistent mental illness, depression, anxiety, personality disorders, and substance abuse treatment. Today, we are going to dive deep, and I mean deep, into the differences between antisocial personality disorder, narcissistic personality disorder. We're going to get into the differences between narcissistic personality disorder and bipolar disorder, and really give you guys an in-depth look at why these labels can be extremely dangerous, but also why they can be extremely helpful as well. I think this episode is going to be extremely informative for everybody and really give you a sense of what these diagnoses are, what they mean, and what they really look like. Hi, everyone, and welcome to another episode of Next Up Narcissism. Today, we have the absolutely brilliant Dr. Haji, and I could not be more excited to have you on here. You know that I'm a massive fan of you and your work, and I said this to you before, I have never heard of somebody speak so eloquently and so clearly and so in such a relatable way about narcissistic personality disorder and antisocial personality disorder and psychopathy and all of that stuff. And I think you're the perfect person to have on here to talk about it, because you talk about it in such a way that makes sense. And it's so nuanced based. And it's really important that you get somebody who specializes in this to be able to explain it appropriately. So I have a ton of questions for you, and we're just going to get right into it. So really quickly, just kind of tell people what your background is and what your specialty is.
Okay. First of all, thank you so much for having me, and thank you so much for that compliment. It means so much to me because I feel like a lot of people talk about, clinical issues using clinical mumbo jumbo, which doesn't relate to the layman. And so I appreciate that's a huge compliment. Thank you. So my name is Dr. Lina Haji. I'm a clinical and forensic psychologist, originally from New York. I have to let everybody know that, but based in Miami. And I basically worked in prisons on and off for 22 years and forensic hospitals for about in 4 different states. And I have a master's in forensic psychology, and then we're not going to talk about school loans, but then I got another master's in clinical psychology. And then I got my doctorate in clinical psychology with a forensic emphasis. And I opened up my own private forensic practice during the pandemic because I was prisoned out. And so now I basically do forensic and clinical evaluations. And that's that. So I still have a lot of contact with inmates and, correctional facilities. Just I'm not in there 40 hours a week, which is amazing. And I also do some media. As you know, I am also a complete true crime. I'm obsessed. I've been obsessed with true crime since I was a teenager. My mother used to say, I don't understand why you come home and then turn this on. Like, don't you get enough of this at work? And I'm like, no. So when I got contacted a couple years ago to be like the expert on true crime documentaries, I was like, I'm in. Like, I don't want to tell them this, but I'll do it for free. So when you messaged me that you saw my latest true crime show, shameless plug, World's Most Evil Prisoners on Amazon.
I'll link it in the show notes for everybody, because it is that good. I shot right up out of bed because, of course, I'm watching it at 3 a.m. because that's what we do. And there you were. So good. So let's get into it. So one of the things that I hear a ton from listeners, from followers, from my own patients is that there seems to be this overlap, right, between narcissistic personality disorder, let's say, and antisocial personality disorder. Let's start there. And some people who have heard antisocial oftentimes use it in a totally wrong context. So let's get that squared away right now. That does not mean you're shy. and it doesn't mean you don't like being around people, right? So I'll hand it over to you. What is the actual definition of antisocial personality disorder? Let's start there.
Okay, I love that you brought that up. I think I've made a couple reels on it. So yeah, people say I'm antisocial in the sense that I don't want to be around people, I don't want to go out, and what they really mean is asocial. ASOCIAL. What they really mean is asocial. But, unfortunately, antisocial has become the term of the people. And so people use it wrongly. But clinically, what they mean is asocial. Antisocial really refers to kind of break it down in a easier way to understand. It really refers to somebody who goes against the grain, who goes against social norms. And to put it even more clearly, basically someone who has criminal tendencies, if you will. So somebody who has a problem with authority, somebody who goes against societal norms, somebody who just can't really align themselves with the rules and regulations of society. So typically it's a criminal or somebody with criminal kind of tendencies.
Mm-hmm. So can you be a narcissist and not somebody who does not go with the grain? Can you be a narcissist and be a criminal?
Yeah, 100%. So I think, I don't have the stats in front of me, but I think narcissistic personality disorder and antisocial personality disorder, they have a lot of overlap, as you know. I think the main overlap is kind of the lack of empathy and the lack of remorse. That's where you'll see more of the overlap. So, of course, you can have narcissistic personality disorder and never engage in any kind of criminal activities and follow the laws and live a quote unquote straight edge life. But your characterology and your personality traits will kind of mimic somebody with antisocial personality disorder because of the lack of empathy, lack of remorse, typically lack of accountability, the grandiosity. Whereas someone with antisocial personality disorder is more likely to be caught up in the criminal justice system, but they too will typically display, and I say typically because obviously we want, very well, we want to use nuanced language, will typically display also lack of empathy, lack of remorse, lack of accountability. It's kind of everybody else's fault. So that's where I see the most overlap between NPD and ASPD.
Okay. So let me ask you this then. Do you think that the reason why, let's say, somebody with narcissistic personality disorder may not engage in criminal activity? Now, when I say criminal, I don't mean the abuse behind closed doors. That is criminal activity. I'm going to separate that out for a second. Do you find that somebody with narcissistic personality disorder doesn't engage in criminal activity in that overt kind of way because it doesn't make them look good? Simple.
Ooh, that's such a good, interesting question. And I love that you bring up the point that narcissistic people with NPD can totally be engaging in criminal activity, more likely behind closed doors, or
Yes.
not come in contact with the legal system.
Correct. Which we see in family courts all the time.
Exactly. Yeah. We see that in family court all the time. I stay far away from family court, but I've been there. And I agree. I think, for example, it's harder to quantify, as we know, emotional abuse, right? And mental injury. And that's something that is just now starting to prevail in our legal system, thankfully, because it can be way more damaging than any kind of physical abuse, So I think you bring up a really good point that the narcissist's main, as the narcissist's main goal in life is how they're perceived by others, because they are obviously driven by a deep lack of insecurity. And so they need to portray themselves to the world in a certain way. So if they were to engage in something like a robbery or a carjacking or drug dealing, that would not align with their goal of I'm the best in the world. And so I think maybe that's why sometimes we don't see people with narcissistic personality disorder engage in these overt criminal activities like somebody with antisocial personality disorder might be more likely to do.
So I'm gonna throw out a name here. Obviously, you do not treat this person. I'm just giving an example of behavior. somebody like a Bernie Madoff who does this massive Ponzi scheme, right? So clearly narcissistic in every way, right? But also totally going against societal norms, breaking laws, zero empathy, could care less. So in those situations where I think people have the idea of criminal activity as violent, right? Gory, violent, guns, things like that. What do you say about kind of these more financial crimes that clearly hurt people?
I love that you brought that up. I have a presentation on psychopathy where I bring up Bernie Madoff, because when we think of psychopaths, obviously we think of your Jeffrey Dahmer, your Ted Bundy, your Charles Manson, and we associate it, like you said, with overt violence. But somebody like a Bernie Madoff or a Jeffrey Epstein, or even or like
Perfect example.
Even P. Diddy potentially, allegedly. Let's use all the correct lingo.
Quite possibly.
Yeah, quite possibly. Yes. We don't know. We're not
we
making any inferences here. Those people, they definitely possess antisocial traits, because even though they managed to, Bernie Madoff, for example, managed to successfully, quote unquote, be in Wall Street and be financially successful. Did he have antisocial tendencies? Absolutely. This is somebody who robbed people of like their life savings. And if you look at victim impact statements, like you see old people saying, we trusted him, and now we have to work at Walmart at age 85 because our money is gone.
People committed suicide.
Yeah, people committed suicide. The impact was huge, and yet we're not viewing him the same way because he wasn't a Jeffrey Dahmer. He didn't have bodies in his freezer.
Right.
And of course, it's important to point out that for somebody to meet criteria for antisocial personality disorder, they do have to meet criteria for conduct disorder, which is essentially antisocial personality disorder in kids and adolescents, which means they have to have displayed traits prior to the age of 15. Now, we don't know, that's the thing. We don't know. Did somebody like Bernie Madoff engage in lying and cheating and manipulating and going against authority prior to the age of 15? He might have. So he could very well meet criteria for antisocial personality disorder. I think we just don't have enough information.
Mm-hmm. And so I guess at the end of the day, doesn't matter.
I totally agree. It doesn't matter, whether, and this is where I love your content online, because, people are so quick to label somebody antisocial or narcissistic, and, whether or not they meet full criteria for the disorder per the DSM-5-TR, which is only one tool, that doesn't mean people can't have traits, right? And so it's, it does annoy me that people are so quick to be like, my ex is an a-hole, he's a narcissist. And it's like, what, hold on, just because you disagree with someone, or they lied to you, or they treated you really poorly, or they were manipulative, doesn't mean they have narcissistic personality disorder, but they can certainly have traits. Personality is on a continuum. Antisocial personality disorder, narcissistic personality disorder, even psychopathy is on a continuum. So somebody can be the world's biggest a-hole and still not meet criteria for any of those personality disorders.
And that's when I say to people, okay, so I find sometimes that because these relationships are so, let's say intimate relationships for this, are so unbelievably multi-layered and complex, and just make you they just make you batshit crazy because you don't know which end is up, because you've been gaslit for so long. So you literally feel like you're going crazy. It's difficult, I think, for people to even acknowledge, right, that anything's going on. And so I think when people start to feel that something's not right, they almost in their mind, because they feel that they're at fault for so long, because they feel like they have no good footing in this, because they don't feel they have a good enough reason to leave, let's say, unless their significant other meets criteria for narcissistic abuse. So I'll have people say, okay, so they do this, and this, but they don't do this. So somehow then that means they're not diagnosed with narcissistic personality disorder. Therefore, you should try to stay and make it work because you don't have a good enough reason to leave. And so what I want people listening to understand is that it doesn't matter if they meet criteria or not. Toxic behavior is toxic behavior, right? And unhealthy behavior is unhealthy behavior. If it does not work for you and you are not happy, or you are not safe, or whatever the case may be, you don't need to meet a criteria in order, your significant other doesn't have to meet criteria in order for you to leave or to cut ties.
I totally agree. And I'm so glad that you brought up that point, because as you mentioned, do they really need the diagnostic label? A person can be a horrible human being and not meet criteria for a personality disorder. Somebody can gaslight you and make you feel like you're crazy and you're off, you have no solid footing, like you pointed out. Or somebody can cheat on you a million times, or pathologically lie to you all the time, or verbally abuse you. That doesn't mean that they need the diagnostic label to justify you being like, enough is enough. And this is what I think, I haven't done therapy in a long time, but I think when I was when I was doing therapy, it's almost like, why do you need it to be here for you to decide that you don't deserve better? Even somebody who cheated on somebody once, that can be, that can be more than enough for somebody to say, I deserve better and I'm leaving, even if they're not antisocial or narcissistic.
I think because, my professional guess would be that as a society for so long, and I do think this is changing with younger generations, but as our society in general focuses so much on, you stay, you make it work, you make it work, you make it work. It looks bad. You don't want to have a quote broken home, without the understanding that sometimes the broken home is the home where, right, the two people are together, where it's extremely toxic. So I think that for so long it's been grilled into our heads. You stay. And that's why people look to make sure it's so bad, right? Like if it hits that level, then it's acceptable to leave.
Yeah, I agree. And I would like to think that the younger generation is not putting up with what maybe you and I had put up, or what our parents put up with.
Yes. Yes.
Even in my family, my mother and father, they had their own issues, and I love them both dearly, but, they stayed for the kids for a very long time, and it ended up having a really adverse effect on my sister and I. And I think that you probably see that a lot, where it's like this old school idea of like, we want the house and the white picket fence and the family together, and maybe we don't want our neighbors and our community and our church or whatever, or our temple to, judge us. But it'll end up having a worse effect, not just on the parents, but on the children.
Oh yeah.
You're staying together. I would like to think that the younger generation is putting their foot down a little bit sooner. Maybe I'm just being hopeful.
No, I see that. I think people are getting married later, or not getting married and living together. I think there's a lot more flexibility with that. I think about my grandparents, and I'm thinking like, oh God, how many of them were actually happy? They got married at like 17, and this is, so I think, yes, I think a lot of that has changed. I think the awareness of toxic behaviors and the ability to speak openly about it, I think, is really helpful. I don't think people necessarily feel as stuck, and this is why I always talk about red flags, to be able to identify it earlier on, so that you're not battling, trying to get out later on in the relationship, or struggling to figure out what is going on, because you recognize it sooner.
Yeah, also the laws, like I don't think women were allowed to have a bank account till like the 70s, or like we forget about that stuff. You really had no choice.
No, you had no choice, and something was wrong with you if you weren't married.
Yeah, and now you're an old maid, or you're divorced in the 50s and 60s, so something is definitely wrong with you, especially as a woman.
I even remember my grandmother. I must have been, I was still in grad school. I was like 25. And my grandmother was like, I know, I'm going to be dead before I have grandchildren. Like, what? Like, even this was like, so yeah, it's still there.
Yeah, it's still there. It's still, yeah, it's still there.
So, okay. So I have another question, and this is one that I was getting from people. And I'd love to hear your probably way more eloquent way of differentiating, but psychopathology and sociopath. Talk about the difference, because some people will call people a psychopath, a sociopath, and
this is my favorite question, because it's my biggest pet peeve. So sociopath is actually no longer a thing. The correct clinical term is psychopath. We used to call people sociopaths because they were so we used to call people psychopaths because we viewed them as born that way, born psychopaths, and then sociopaths were more viewed as made that way as a result of their environment. So that, and also that's one way we used to differentiate them. And we also used to differentiate them because the word psychopathy was so similar to the word psychosis.
Yeah.
So in order to not confuse people, they used to use the term sociopath. But the more recent research really proves that psychopathy emerges from a biopsychosocial model, like most disorders, right?
Can you explain what that is?
Yeah, absolutely. Yeah. So instead of you're born that way and something's wrong with your brain and you were born and you're going to be Jeffrey Dahmer and you're going to kill and you're just a psychopath, versus, you had a horrible traumatic childhood and you were severely abused and so you began to hate people and so you became a sociopath, a nature versus nurture kind of psychopath. What we're looking at it now, and the research points to biopsychosocial model, meaning there are biological factors that make you a psychopath, there are sociological factors, and there are neurological factors, biology, psychology, and sociological factors. And so because of that, we no longer use the word sociopath because it really just doesn't make sense. Most psychopaths that have been studied, they show everything from brain injuries, traumatic brain injuries are really high in psychopaths, to abusive childhoods, to the fact that they just had conduct disorder from a young age, and so psychopathy and psychopaths are now viewed as, just like every other disorder, a complex combination of different factors and it's also just like anything else, it has to be individualized. This person might have turned into a psychopath because they did have a brain injury as a kid, their frontal lobe is messed up. And this person might be a psychopath because, they did endure horrific trauma and they didn't have good coping skills for anger. And so they decided to go on and kill. Just like every other disorder, it needs to be individualized.
Yes. Do you find in working with people that the treatment process, protocol, outcome is different for those that exhibit this behavior because of a TBI versus those who were kind of nurtured into that personality style?
Yes, 100%. And really the treatment of choice right now for psychopaths is really behavioral modification, because a lot of psychopaths they can't do what we call insight-oriented treatment, right? And we actually tried that with psychopaths and it ended up making them worse. I think you know this. Yeah.
I do. So I tell this to people all the time when they talk about empathy. I said, there were studies done, and I don't know, you'll know better than me, but I know that they were teaching inmates empathy skills that reflected empathy. And what happened was they adopted those skills, but to use them as part of their repertoire for how they manipulate people. So they actually made it worse by teaching them skills of empathy because they actually don't feel it. They can fake empathy. They cognitively may understand what empathy, but they don't feel that, and they'll use it to their advantage. They can play the part.
Yeah, I think those studies are fascinating to me because it makes sense, right?
Yes.
It makes sense. We're going to teach them empathy. We're going to teach them remorse. We're going to, they even had a lot of these psychopathic inmates do what's it called? Restorative justice, where they met with the victims' families.
Yes.
Which is horrible now that we know better.
They have a documentary. I have to think of the name, and I'll link it for people, where they actually have the inmate meet with the victim's family. And I remember watching this going, bad idea. They didn't consult a psychologist on this because this would never have happened. It was awful.
Yeah. And like you pointed out, so they're literally incapable of experiencing empathy and remorse the way somebody like the way you and I experience it. And so they started to mimic that empathy and remorse. And I think, I could be wrong, don't quote me on this, but I think when they studied those people in a longitudinal way, in a long-term way, they found that they had higher recidivism rates because they used the manipulation to their advantage. So the treatment of choice for psychopathy or people with psychopathic traits is behavior modification, because, you might not be able to change what they think and what they feel, but you can always change, the behaviors. So you might have urges to kill people, but let's find a coping skill for an outlet instead of killing people. Really, is what it boils down to.
Right. And with behavior, I mean, I have to be honest with you. I mean, I use behavior modification even in depression, anxiety, because it's so unbelievably impossible sometimes to change somebody's thinking and I right and their emotions. It's like your behavior is not necessarily even connected to the thoughts and emotions. And I know there's people listening going, what is she talking about? But for pure behavior therapy, I mean, it really, you can do something and still be anxious. You can do something and still have urges, right? And so, for people listening, it's not that you are leaving out it's not that we don't respect the idea of emotions and cognition and things like that. It's just that sometimes it's not always necessary for behavior change.
I totally agree, and I love that. And I was super trained in CBT, like CBT, and I have a huge respect for CBT, but I also have a huge respect for other modalities. Whether it's Gestalt or person centered or insight oriented or Jungian, whatever. Research shows that the main factor that's successful with therapy is the alliance and the rapport with the therapist, right? So I'm never going to knock any other kind of evidence-based therapy. But I agree with you that behavior modification is so important. For example, like you said, somebody with mild to moderate depression, if you can tell them, like, look, I know you don't feel like going walking in the park, but just do it anyway, because after the fact, you're going to feel better, or you're likely to feel better, then yes, and of course, as we know, it depends. Again, things need to be individualized. Is this somebody who's so majorly depressed that they require hospitalization, that they require ECT or medications, but there's no one size fits all. So that's the problem that I see. I digress a little bit, but that's the problem that I see on social media, that people are like, oh, you have this disorder, well, here's the treatment. Well, no, everybody's different. We don't know.
Correct.
You know what I mean?
Correct. And I think that's the part of a good clinician, to be able to determine, right, what works best for everybody, and also to know if a certain client's not right for you and refer out if so here's a question I get all the time, and I always hate giving my response to this because it really, it kicks me in the gut every time. So I'm curious to get your response on this. Do they know what they're doing, and do they care?
That is such a good question. So I would say, when it comes to psychopaths and people with antisocial personality disorder and even narcissistic personality disorder, let's just lump them in. I believe that the majority of them know exactly what they're doing. Now, of course,
Why do you think that?
Why do I think that? Well, again, it has to be individualized. What is their cognitive level of functioning? What is their IQ? What is their history? Of course. But in general, why do I think that? Because the behavior is typically self-serving with all three of those diagnoses. And I should point out, psychopathy is not a diagnosis in the DSM, but let's just, as a construct. So people with psychopathy, people with a narcissistic personality disorder, people with antisocial personality disorder, if you look at their behaviors, they're typically very self-serving, which tells me they know exactly what they're doing because it's a means to an end. They are committing crimes, or they're gaslighting somebody, or they're emotionally abusing somebody, or they're murdering somebody because in some way, shape, or form, it serves their wants, their needs, and their ultimate goal. So again, we're overgeneralizing here, which we already discussed a million times, but typically I believe people with those personality disorders know exactly what they're doing and just don't care.
Correct. And I hate giving that answer to people because, particularly with narcissistic partners, especially narcissistic parents, I have to tell you that one of my most difficult, gut-wrenching patients, sometimes scenarios, is when it's the parent that's either, that meets criteria for any of those cluster B. It's very unnerving to have to tell an adult child, like, well, yes, they knew what they were doing, right? Or, for your partner, yes, they know what they're doing. It's a really hard thing to internalize because it makes no sense to somebody who doesn't have that personality construct. And I think that when they hear, like, yes, they know what they're doing, it's very hard for them not to think, okay, well, what did I do to deserve this? Right. Or, right. So for you, when you work with people who have these personality constructs, they know what they're doing, they show no remorse. What do you tell the people that are on the other end of it?
That's such a good question. And I think that in a way, and you could tell me more about it. I think initially it's, oh my gosh, that's so hurtful. They know what they're doing. And that means that there's a conscious effort to actually hurt me. And that is horrible. But somewhere down the line, that also has to be helpful in the healing process, in the sense that you get to actually, once you get to the point of acceptance, that it's like, wow, there was a conscious effort and they knew what they were doing. That gives, I'm assuming that gives the victim, I don't really like that term, but the victim or the survivor, the ability to now have some power and realize, well, now I have a choice to make. Do I want to put up with this, or do I want to do something about it? And it's empowering, and it can be healing. So when I deal with people, and a lot of time inmates they're on both ends. They can be abuser and they have a history of abuse. So many inmates have a trauma history. So rectifying that, like, how was I treated so horribly, and then I went on to treat others so horribly, is so complex and convoluted. I think when you're working with victims of these cluster B personality disorders, it can also be very empowering and freeing to let them know, like, their behavior literally had nothing to do with you, nothing to do with, and if it wasn't you, it would have been somebody else. And as a matter of fact, when you leave, odds are it will be somebody else.
I always say that when somebody is in a narcissistic abusive relationship, and understandably so, they are so worried, that one of the many reasons why, but they're so worried when they leave, what if they change? What if their partner all of a sudden becomes this wonderful human being? And listen, we've all been in relationships where we're concerned that, even with a non-narcissist, if we leave, are they going to be better with somebody else? Are they going to take everything we taught them and use it with somebody else, right? And and they get the benefits of everything. So I think it's very common, but when you're dealing with, let's say, a narcissist, and there's a very distinct, we say, blueprint to their behavior, and it's a very predictable textbook cycle, and in all their efforts to be creative and slick and sly, they are the most predictable from a behavioral standpoint.
I agree. And I can so relate to what you just talked about, because let me not kid myself. I definitely had some boyfriends in my adolescence, in my 20s, that are now happily married. And I'm like, oh yeah, of course. Well, I made him.
That's because of me.
Like, yeah, he turned out fantastic because I trained him that way. And now, you know what I mean? Like, you want to take,
yes.
I mean, I'm not going to lie. I'm not just a psychologist. I'm human. And it's like, oh yeah, okay, you're happily married with 3 kids now because I trained you to get that.
Correct. Correct. It's like you want credits rolling at their
wedding.
Yeah,
you want credits. Someone call his wife and be like, let me tell you how he was a piece of crap when I met him, and I made him better, But there's also like some self-delusion in that, because you and I both know that people don't change unless they want to change. That's just, we don't have a magic wand. They can do all,
and not just change, maintaining change. We talk about changing, maintaining the change through stress and crisis and trauma that will happen over life, because life is life. Maintaining that change.
Yeah. And also, you and I know from our clinical training that people with personality disorders are the hardest to treat, because it's who they are. It's not like schizophrenia or bipolar disorder.
Correct.
Or even autism, where you can, this is characterological in nature, which means it is essentially who you are as a human being. And per the DSM-5, it's a pervasive pattern of characterological traits, right? So you and I know that these are the hardest to treat. There's research that antisocial personality disorder decreases with age, like people age out of criminality, so to speak. But with narcissistic personality disorder, and I get that fear that this maybe, I'm going to use a woman as an example, but I'm going to leave him and he's going to change. Yeah, okay, he might change superficially, like you said, for a while.
He'll go back into the love bombing, or she'll go back into the love bombing, and that's all you'll see.
And
so you will think that.
See. But unless this human has 100% decided, and I'm not going to say it's impossible because, I went into this field because I believe people are capable of change, as I'm sure you did too. Do I think everybody is capable of change? And this is an unpopular opinion. No, I don't. I think there are some people.
I agree with you.
Yeah, there are some people who cannot be rehabilitated. Like, I even said that on, I don't know if you remember the episode 1, Jamie Osuna on the crazy one with the face tats.
Yes.
Yeah. Like, can somebody like that be rehabilitated? Probably not. Like, that guy's a psychopath, and we can give all the interventions and all the treatment. That someone like that is not going to change, and that is an unpopular opinion because we want to believe like kumbaya, everybody can change, but no. And it's really hard to change personality patterns. And if somebody with narcissistic personality disorder decides finally at some point, gosh, I'm messing up my own life, I'm losing all my relationships, maybe there is actually something wrong with me and I can go to treatment and change, is that a possibility? Of course. Does that mean that it's likely to happen and prevail? Probably not. And that's
think about how hard it is for somebody without a personality disorder to make change in therapy. I mean, right? Like, I mean, I've been in therapy before for anxiety. I mean, ask me if I'm still anxious. Of course I am. Of course I am.
I've been in therapy my whole life, and I am never ashamed to say that I really believe in the power of therapy. And depression and anxiety, those are things I've struggled with. And do they maybe do I have maybe more insight
and coping?
Better coping skills, more insight, more avenues. I have more insight into my triggers and when I'm going down that path.
Correct.
Do I still struggle with depression and anxiety? 100%. 100%. And that's just, a reality. That's life.
I mean, it's life. And the difference, I think, between, what we're talking about and personality structures that are very inflexible is that, it's one thing to acknowledge that your behavior hurts others. So let's say I do something and I realize, I really impacted my kids with that. I feel horrible. And I would do anything I could to change. Whether I was able to make that change or not may take a long time. I may go back and forth, but I have empathy. I have remorse. I want to make it, I want to work in that direction. And I may take 10 steps forward, 12 steps back. And it's a process such as life, right? Somebody with a personality disorder, they are aware that their behavior is impacting somebody else, right? And when we talk about I'm going to leave borderline personality disorder out of it because I think it's a different.
Yeah, it's a little more complex. It's more
different. Yeah, it's different. I think for narcissistic personality disorder and antisocial personality disorder, the concern that they're harming others, they know they're hurting others. They don't care. The concern is not there. The remorse and the empathy isn't there. So when you have to make a change with that mindset, you have literally no motivation to change.
I 100% agree. And I think that's why those two personality disorders are, and we have research on this, are the hardest to treat. Because if most change stems from, an incongruence with how we feel and how we act, right? So, so if you're in a depressive episode, you might be sleeping all day. And then by day 3, you might say, I got to do something different. Like, I don't want to feel this way. I don't want to act this way. Let me reach out to my therapist, or let me call my psychiatrist, or let me call a friend, whatever it may be, or let me go for a walk. Right. But like you pointed out, when you are narcissistic or antisocial, there's no internal heads up, like, this is not working for you, because your victims are other people. You don't really think
you're fine.
Yeah, you're fine.
You're fine.
So that like motivation to change. And I agree. I think borderline personality is very different, because I think borderline personality, people with borderline personality,
they want to.
They're suffering. I think
they're suffering. I agree with that. That's why I put it.
Yeah, we forget that. I think it's so easy to be like, oh, she's borderline or he's borderline, but
no, they hate how they feel. They hate how they feel.
Yeah. And so that's a completely different dynamic than, I hurt her for 20 years, but I don't care.
Right. Absolutely. you touched on something and I want to hit on this really quickly. I know this could be for an entire other discussion, but you do a lot of these on your Instagram of misdiagnosing people, which I love. So I oftentimes will get, the significant others or the children of narcissists. And one of the things that I see so often that people with narcissistic personality disorder are frequently misdiagnosed as having bipolar disorder. And it makes my blood boil.
Same.
because it is not mood swing. Like this whole idea of you never know what you're going to get walking on eggshells. One day they're this and then 5 minutes later they're that. That's not bipolar disorder. Can you just kind of, in 3 minutes or less, just kind of give the overview of why that is not bipolar disorder and what bipolar disorder is? Because the amount of, I'm just going to say it, professionals that misdiagnose narcissistic personality disorder, borderline personality disorder with bipolar disorder is mind-blowing.
Okay. I love you for asking this question because it's literally my pet peeve. And I also want to point out that, yeah, I do my misdiagnosis Mondays. It's my favorite thing ever. But also diagnosis is only one piece of the puzzle, right? Diagnosis is not the be all and end all. I am a proponent of accurate diagnosis, but you and I both know that two people with narcissistic personality disorder or two people with schizophrenia or two people with anxiety are never going to present the same. Everybody is different. And people also forget that the point of diagnosis and the point of the DSM-5 TR, it was really developed for clinicians to have a quick and easy and dirty way to convey information to each other. It wasn't made for the layman. So if I evaluate somebody and then you're going to do their treatment, I'm just going to tell you, hey, heads up, he has NPD. But that's the only thing that tells you, right? So that's the number one. Number two, people think bipolar disorder is mood swings. I get this all the time, particularly in correctional facilities. So I'll ask an inmate, he'll be like, I'm bipolar. And I'll ask an inmate, what makes you think you're bipolar? Well, when I wake up in the morning, I'm in a super good mood. And then in the afternoon, if my girlfriend hasn't written to me, I get super angry and then I just want to hit people. And I'm like, okay, that's called life. That's not even a disorder.
Right? Thank you.
That's called life, and that's called normal stressors. So that's number one. Number two, I see people with narcissistic personality disorder and borderline personality disorder get misdiagnosed with bipolar all the time. What people don't understand, true bipolar disorder has nothing to do with mood swings or very little to do with mood swings. Thank you. Mania means you're up for 3-4 days without feeling tired.
Yes.
Mania is a neurological problem in the brain where you are up for 3-4 days, where you have this is where I think the NPD.
It's a distinct period. It's a distinct
period. And I think where the NPD might come in is because you might have, ideas of grandeur or grandiosity, or I can take over the world, and you start many different tasks and you don't necessarily finish them, or you might even have psychosis. And then there's a dip, typically a dip into depression, like a super low, I cannot function, I cannot motivate. So bipolar disorder is not mood swings. It's mania, which is 4 days to 2 weeks, or it's depression. Whereas narcissistic personality disorder and borderline personality disorder, you mentioned somebody saying, oh, I never know what I'm going to get. Well, you never know what you're going to get because that's his or her choice, what mood they're in, what they're trying to get accomplished. And the grandiosity in narcissistic personality disorder is very different than a grandiosity you'll see in bipolar disorder. In bipolar disorder, it's almost psychotic in nature. It doesn't make sense. It's disconnected from reality. Whereas the grandiosity in narcissistic personality disorder really stems from this insecurity and the world needing to think that I'm better than. It has a very different flavor.
Yes. And in between that manic distinct period and major depressive distinct period, how can somebody present in bipolar disorder?
They can present as, totally normal.
Totally normal.
Totally
Correct.
normal. And even the first line of treatment for bipolar disorder, let's be very clear, is psychotropic medication, is a mood stabilizer because it's neurological. Narcissistic personality disorder, you're not going to see a change on medication.
No.
You're just not.
No, that's right. I am so happy you explained it the way you did, because the amount of times I see this misdiagnosed, and it really drives me crazy because first of all, the process of bipolar disorder, what it looks like, the course of bipolar disorder has absolutely nothing to do, and it doesn't even remotely look like it. And it's because people have latched onto this mood swing idea as bipolar disorder, which it is not, right? And in between those episodes, distinct episodes, the person presents as, quote, stable. Now, they may have like things that had happened during their manic stage where they have to deal with the consequences after. And so they may tend to self-medicate and things like that. But when they're sober, you see that stability. When you're dealing with narcissistic personality disorder, antisocial personality disorder, it is exactly like you said. And I love that. And I'm going to absolutely take that from you and credit you. The difference is they have the choice of the mood they want to present with because it serves a distinct function for them. And that function is power and control. Bipolar disorder, moods, manic or depressive, it has nothing to do with power and control. It's something they can't even control themselves. They're not trying to control somebody else.
100%. And the grandiosity, the function of the grandiosity is completely different in bipolar disorder, where it's like beyond their control. And it's just, I'm going to conquer the world because they're manic. So they think they can conquer the world because they're manic. A narcissistic person who's saying, I'm going to conquer the world, is saying that because they have a characterological personality problem where they think that they're better than. It's a very, very different presentation than somebody with bipolar disorder. And borderline personality disorder too, just to offshoot a little bit, I'm with you. The amount of clinicians, whether it's social workers, psychologists, psychiatrists, don't get me started, who misdiagnose borderline personality disorder as bipolar disorder drives me nuts. And at the end of the day, the person who is suffering is the patient, because you're giving them lithium and Depakote, and you're seeing, of course, and I'm not a psychiatrist, let me make that very clear. You can see some improvement in mood lability with a mood stabilizer. But if a person has borderline personality disorder and they've been misdiagnosed as bipolar, at the end of the day, they're only going to suffer more because they're not getting the proper treatment.
They're not getting the skills that they need. And it's a very distinct set of skills. And people with borderline personality disorder can absolutely improve. But if you
100%
deprive them of that diagnosis and you label them with bipolar disorder and you put them on a mood stabilizer, yeah, like you said, maybe it'll help with lability, but that's it.
That's it. And also,
that's it.
When you misdiagnose people, and this is why it's such my pet peeve and why I've just dedicated an entire day of the week to addressing this, is because number one, when you misdiagnose someone, the patient is suffering. Number two, when you misdiagnose a narcissist with bipolar disorder, you're giving them a pass.
Oh God.
Sort of. You know what I mean?
That's what bothers me the most.
That's what bothers me too.
No, you're not.
I have an excuse. Now I have an excuse. It's a neurological, it's bipolar disorder. It's not my fault. No, you've been misdiagnosed. You have a personality disorder. You're selfish. You're self-centered. And it drives me nuts because now not only is the patient impacted, but everybody in their life is impacted.
That's right. That's right. I thank you. Thank you. Really, thank you. Because like I said from the very beginning, you clarify this in such a relatable way, in a way that people can actually understand it without all the psycho babble crap, and really kind of get to the heart of it and just say it like it is. And I love that about you, and I love your work. Thank you so much for coming on here. I'm definitely going to want to have you on again because I have so many other differential diagnosis questions, and I love how you explain it. But in the meantime, can you tell people, and I'll put everything in the show notes and all your links, but can you tell people where they can find you?
Yeah, of course. And thank you so much for having me. I love your work. I love everything you do. And I resonate with you so much. And it's so refreshing to talk to a brilliant clinical psychologist who gets it. So thank you, because I know your work is very difficult. So my website is www.risepsychological.com. My Instagram handle is the same. It's Rise, RISE, Rise Psychological. I have some trainings actually on malingering and psychopathy. You can get some CU credits if you're interested in those. They're on my website. And of course, my latest TV show, true crime documentary, World's Most Evil Prisoners, is out on Amazon Prime. I filmed 4 more TV shows. So I'm going to be shooting you some DMs and some text messages because I want to get
send it.
When they come out. But yeah, World's Most Evil.
In my next life, I'm going to be you and do your job because I am fascinated by it.
It's so funny because every time I film these shows, they think forensic psychologist means FBI profiler. Like they think I'm Clarice in Silence of the Lambs. So I'm like, no. They're like, what does leaving the knife at the scene mean? And I'm like, I have no idea. That's not what I do. So, yeah, but thank you so much for having me. This was so awesome. We could talk all day
for hours. Thank you so much. And again, I will link everything in the show notes, all the links and all of that. So thank you again for sharing your brilliance with us. And we will definitely. Thank you for tuning in to another episode of Next Up Narcissism. I hope you found it useful, but most importantly, I hope you found it validating. Want to work one-on-one with me? Visit my website at drjamiezuckerman.com to book a personalized coaching session, and be sure to check out my on-demand workshops on topics like co-parenting with a narcissist, life after leaving, anxiety management strategies, and more. Again, that's drjamiezuckerman.com. You'll also find links to my interactive workbooks, merchandise, resources, and newsletter sign-up. Next Up Narcissism is as much your podcast as it is mine. I want to hear your feedback and what you want to hear. So make sure to leave a podcast review wherever you listen, or send an email to nextup@drjamiezuckerman.com. Again, that's nextup@drjamiezuckerman.com. Be sure to subscribe so that you never miss an episode. And as always, thank you so much for listening. Make sure to tune in next week to see what's up next on Next Up Narcissism.